Are you having pain in or around the kneecap? Chances are you're going to describe it in one of a few different ways. Either a pain underneath the kneecap, a pressure, or even that feeling of like there's an air bubble between your patella and their leg, like something stuck in there. Or pain that goes and radiates down the inner or outer border of your kneecap. Often, you're going to get this pain with steps, especially going down more than going up, squatting, lunging, or anything where you're loading into that knee. This is very common and very irritating. My name is Dr. Joe, and I'm a licensed physical therapist and sports performance coach. I can tell you exactly what's going on here because I've had it happen to many of my clients. And I've been very successful treating this. But many people aren't because they don't understand what's going on and they're going about it completely wrong. So I want to walk you through what you should be doing. Before I do that, I want to tell you what's happening because if you understand what's happening, you're more likely to know what to do, when to do, and why to do it. So, take a look at the picture of the backside of the patella here. What you're going to notice is these different grooves and ridges. It's not a smooth surface. You're going to compare that to the surface it sits on, the femur, and you see these rounded edges as well as a groove in the middle. Your patella rides along that groove and distributes the force across the cartilage and bone that you put into your knee. If you distribute that force correctly, you don't have pain. If you put too much of the pressure in one area, maybe it's inside, maybe it's outside, maybe it's directly under, it doesn't so much matter, but the problem is you're putting too much stress in one spot. You're creating irritation, swelling, and pain. A little example to show you what's going on here. I want you to take your thumb and I want you to dig it into your thigh or into your hip. What you're going to notice is it's uncomfortable. You're pressing into a trigger point. That's not a very comfortable thing to do. But what I want you to do next is to make a fist. Go to that same position and put some pressure in. What you're likely going to notice is that with that pressure on your fist, you don't get pain. So we take the same amount of force and we concentrate it into our thumb or distribute it across our knuckles and our hand, and the amount of pain is different. So what we need to do at the patellofemoral joint, the fancy name for that kneecap interaction with the femur, is to distribute the force better. We do this with the correct muscle tension, strength in the quad, and sufficient mobility around the knee. We do those things, and your knee pain should go away. Now, what you don't want to do is just completely rest it, because when you completely rest it, you decondition the muscles. They get weaker. You take away all of the good stuff that happens with movement physiologically, blood flow, lubrication of the joints. You're taking all of that stuff away, and so a lot of times when you rest this injury, it doesn't get any better. Or it gets better for a short period of time. You try to come back to whatever the sport or activity you love is, and it just starts to hurt again. So instead, I'm going to give you active exercises that are allow you to address that area and get back to function much more quickly. First, myofascial release of the VMO, or the vastus medialis obliquus. You're going to find this muscle a little bit above the patella and slightly to the inside. If you squeeze your knee, you'll see it puffs up a little bit more in here than it does on the outside of the knee. That's what we're going to treat. You can do this in two main ways. You can take a ball, press it onto that muscle with your hand, and roll it around. Find that spot where you get that good hurt and work that muscle until it starts to relax. The other thing you can do, and my preference, is to use a wall or rig or something sturdy. To do that, I'm going to take the ball and I'm going to pin it against something. I'm going to lean my weight into it and start to move that ball back and forth, up and down, pretty small movements, but it's going to allow me to put the necessary pressure into those muscle fibers to make them release, calm, and relax. And I'll tend to work on this for about 2 to 3 minutes at a time. And what you may notice is that right after, you can bend the knee a little bit more. It'll have less pressure, less pain, and better ease of movement. Next, we want to load the area. So you're going to lay back on the ground, one knee bent, the other knee straight. The first thing I do is squeeze my quad muscle. To do that, one, you can think about squeezing your quad. Two, you can think about driving your knee into the ground. And that should create some good pressure in your quad. And again, you should be able to see it activate or feel it activate. Once you have that activation with your quad, you're going to lift your leg only slightly, hold maybe 3 seconds, and lower down. This is where it gets important to individualize. I've had clients who have a squeeze, lift, and lower. They'll do that 10 times and feel sufficiently challenged. Other clients are going to have to squeeze, lift, hold for 3 seconds, maybe even 5 seconds, lower down, and do that 8 to 10 times to feel enough challenge. So you're going to have to find that right balance for you. You just want to feel like the quad's working by the end of the set. Now, if you want to really increase the difficulty, what you can do is sit all the way up, arms supporting you, squeeze the quad, lift, and hold here, lower, relax. Squeeze, lift, lower. Because you're shortening some of your muscles at the hip, they help less, and the focus goes to the distal or the lower part of the quad even more than it would normally. So that's another way to challenge the quad. Make sure you relax between each repetition so that you can re-engage. And again, perform these until you feel like there's sufficient challenge. We've now addressed the muscle tissue when the knee is straight. We also want to address it when the knee is bent. So we're going to do what's called a seated knee extension isometric. So I'm going to position myself against something that's not going to move. A wall works great. I'm going to use the rig for the purpose of this video. From here, I'm going to kick out like I'm trying to kick my leg straight, but it's not going to move. I'm going to hold that kick for 3 seconds and then relax. Now, I can kick as hard as I want, and this isn't going to move. So when you're thinking about how hard you want to kick, you want a comfortable but hopefully challenging amount of tension. If you're kicking so hard that it creates a lot of pain in your kneecap, bring down the intensity and find an intensity that's tolerable. Now, depending how your patellofemoral pain is acting, a certain position will be more irritating than others. And you're going to have to trial this. So you notice my knee is maybe halfway between straight and bent. If this position that I tried first is uncomfortable, I'm simply going to move my chair closer so that I'm closer to a 90-degree angle. Then I'm going to kick out, trying to extend my knee using this quad muscle. 3 seconds, relax. Kick, 3 seconds, relax. So I would trial that, and you can even get a little bit closer with a few different positions and find the one that works for you. Again, if you want these exercises to be the most beneficial, you're going to have to individualize them at least a little bit. Your comfortable position is going to be different than my comfortable position, as well as your level of contraction. A little bit of trial and error should help you dial into that perfect amount of stress for you. Now the rules and guidelines. You're going to complete all of these things every single day. For the massage ball work, you're going to spend about 2 to 3 minutes, at least once, if not twice a day, kneading and working into that VMO muscle. You're going to do these exercises for 2 to 3 sets, probably somewhere in the neighborhood of 10 to 15 repetitions. Again, whatever you can sufficiently challenge the muscles with. You'll notice over the next few days that it's likely going to start feeling a little bit better. Stick with the long-term approach, but as it feels better, get back to your normal activities. If you want to spend time at the gym, strengthening the area, that is only going to help. So return to that normal stuff because building strength back up is what's going to prevent this from happening again. I hope this was very helpful to you. If it was, please hit like and subscribe on this video. If you have any questions, leave them in the comments, and I'll catch you next time. Good luck dealing with that knee pain. And a reminder, I'm Dr. Joe, licensed physical therapist and strength coach.